Hi there, my name is Jay Lusk and I'm your GPSC president. In this brief video, I'm going to run through an overview of the testing component of Duke's Return to Campus plan. As a brief disclaimer, it's important to note that the policies and procedures I describe in this video are subject to change at any time based on public health guidance. Additionally, I want to emphasize that washing your hands, maintaining effective social distancing, and wearing a mask or face covering are the cornerstone to our COVID-19 response this fall and are essential to keeping our community safe. With that being said, let's jump right into testing. The first type of testing we'll discuss is baseline testing. In baseline testing, all students are tested at one time point when they initially arrive to campus. Contrast that with pooled surveillance testing. In surveillance testing, groups of students will be tested together. If any are positive, all will undergo a full diagnostic test. Of course, anyone who develops symptoms consistent with COVID-19 will also be tested. And if you come into contact with someone who themselves was diagnosed with COVID-19, you should also be tested. Now let's discuss the baseline testing policy. Whether or not you need to undergo a baseline test will depend on whether or not you've already been approved to come to campus over the summer. For example, PhD students working in laboratories and clinical students in the School of Medicine and the School of Nursing will not need to undergo a baseline test. These students may, however, opt into a baseline test if they wish. Otherwise, all students who plan to come to campus this fall will need to undergo a baseline test. This test will be an anterior nares test, which I'll explain in just a moment, and it'll be administered by a nurse at Penn Pavilion. This testing is required before your Duke card can be activated, and you'll need to keep yourself isolated until your results come back, which can take up to 48 hours. Now let's clarify the two different types of swabs that we're discussing. The first swab is an anterior nares swab. This is the swab that we used for the baseline and surveillance testing. In an anterior nares swab, the swab is inserted into the front part of your nasal cavity. Contrast that with a nasopharyngeal swab, which is inserted all the way to the back of your nasal cavity, and it will reach all the way to touch the front of your throat. This type of swab will be used for symptomatic testing and for follow-up on positive surveillance testing. So where can you get tested? All baseline testing will be performed at Penn Pavilion. For surveillance testing, you will actually administer that anterior nares swab yourself and then drop off the sample at Penn Pavilion. Finally, for symptomatic testing, you should seek the guidance of student health. If you become severely symptomatic, you should get medical care, and you can present to Duke Urgent Care or directly to the emergency department. Instead, let's jump right into travel. So first off, what does the travel policy say? It's important to note that this policy is universal. It's not program or school dependent. It also delineates official travel, i.e. that which is supported by Duke funds, and personal travel. For official travel, you can visit travel.duke.edu and you'll need to submit an application. No official travel will be permitted at all until August 10th. For personal overnight travel, the policy recommends that you limit any personal overnight travel and that you only travel for essential needs. You're also expected to follow all public health recommendations when you're engaged in any personal or Duke-supported travel. You will also need to report your travel history on symptom monitoring when you come back to campus. The key public health guidance from the CDC, as you can see at this link, is really the same as the public health guidance that we have on our campus. Wear effective face coverings, i.e. those that have a close fit over your nose and mouth. Maintain physical distancing at all times. Regularly wash your hands. And importantly, avoid unnecessary travel. In fact, travel, according to the CDC, can independently increase your risk of spreading or contracting COVID. Please do not engage in unnecessary personal travel. Do your part to help keep our community safe and stay at home when possible. If you have any comments, clarifications, or concerns, please don't hesitate to reach out to me at any time. I thank you for your time and attention. That being said, let's jump right into this topic. So first, what does the policy say? First, if you are going to come to campus in the fall, you must report your symptoms daily. This also means that you must report your symptoms even on days where you will not physically be coming to campus. You can either use the REDCap, which is a browser reporting system, or the SimMon app. You'll be asked to report symptoms related to COVID-19, any travel that you've had, and any potential exposures to the virus. Additionally, the policy discusses contact tracing, which will essentially allow for the university and the community to identify, quarantine, and test potentially exposed individuals. For off-campus exposures, Duke will be working in close cooperation with Durham County Health Department. Additionally, there are strict privacy protections to ensure that this data is only used for directly stopping the spread of COVID-19. So let's go over some frequently asked questions. A question we've often heard is, what happens if I have just one mild symptom? The answer to this is that it's crucial to report any new symptoms that develop, and then follow the guidance of student health, depending on what the result of your symptom screen is. What should you do if you fail a symptom screen after hours? You should contact the main student health number or the COVID hotline. In terms of travel, you need to report all overnight travel, and this is crucial to assist in contact tracing. And what happens if you get really sick in between symptom screens? Crucially, if you become sick, you should call student health or seek immediate medical care. For some more frequently asked questions, is Duke going to track my cell phone off campus and triangulate my location? The answer to this is no, absolutely not. What happens with the data that you report? This data is strictly only used for contact tracing. It's not tied to your academic record, to the work that you do, or to any other component of your identity or your student experience. It's to be used purely for contact tracing and protecting our community. And what should you do if you have questions about how to report your symptoms or contacts? The answer in this scenario is always contact student health if you're unsure, and they'll be glad to provide you with assistance and guidance to make sure that you accurately report your symptoms and contacts and that you can do your part in protecting our community. If you have any questions, please don't hesitate to reach me at any time. I hope that this video was helpful, and I thank you for your time and attention.